welcome to Hudson Health. My name is Dr. Etan. I am Chief Medical Officer, Jersey City Medical Center, a facility of RWJ Barnabas Health. In this show, we introduce you to all kinds of special doctors in our area. We talk about your health and all the wonderful technological advances we have, not just at Jersey City Medical Center, but at RWJ Barnabas Health. We're thrilled this month to discuss all things colon health, especially as it is colon cancer month. We will delve into many wonderful things. Stay tuned.
No one plans on heart disease, but everyone should have a plan for it. We help patients of all lifestyles and medical histories plan for healthy hearts. We offer convenient screenings without judgment, hundreds of preventive programs, and women's heart specialists. And we're the largest cardiac surgery program in New Jersey. Make plans for a healthy heart with RWJ Barnabas Health. Let's be healthy together.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or a quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights. Your one-stop store for residential and commercial floor treatments. Carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants. All major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Panapinto Properties, Jersey City, shaping the workplace with state-of-the-art office spaces and addresses your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panapintodevelopment.com. Panapinto Properties, building Jersey City for everyone.
Hello and welcome back to Hudson Health. My name is Dr. Etan. I am Chief Medical Officer at Jersey City Medical Center, a facility of RWJ Barnabas Health. Today, I look very forward to welcoming a special guest, especially as it is colon cancer month, and we want to discuss all things colon health. Our guest today is going to be Dr. Etan Spira. He is a gastroenterologist and also program director of our new gastroenterology program, fellowship program at Jersey City Medical Center. So you see, colon health never really gets the attention it needs. It's not especially your dinner table conversation, if you will, but yet it is important that we talk about it because it affects a lot of Americans. And we traditionally used to think it was a disease of older people, but increasingly younger people. Again, like all diseases, we worry about access to care, especially in underserved communities. And that is why this month we are highlighting an array of exceptional doctors we have, gastroenterologists or stomach doctors as they're called commonly. We would like to talk about prevention. Prevention even of getting cancer itself. Things like exercise, diet, appropriate screening, general health and wellness. We would also want to talk about our facilities and how to get access when people may have very hurried lives and not know that they can get things like a screening colonoscopy easier. Finally, we want to be able to tell this community through our guests that we are available and open to take care of all their needs. I've known Dr. Spira for a long time. He is exceptionally motivated to be the best doctor they can be for this community. We look forward to discussing with many of you. I know some people watching today may have put off their colonoscopy for a while. I understand. It's not exactly the thing you want to do on your day off, but we'll talk about the actual procedure, how easy it is, how, convenient it is for people. We'll let them walk us through one. I look forward to welcoming our next guest. Stay tuned.
Comprehensive healthcare is here, here, and here. RWJ Barnabas Health is healing, enhancing, and investing in Hudson County with its two newest locations, Hoboken and Exchange Place. Within walking distance or accessible by mass transit, our locations combine convenience with primary and specialty care, including cardiology, women's health, orthopedics, cancer care, and more. Let's be healthy together.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Panapinto Properties, Jersey City, shaping the workplace with state-of-the-art office spaces and addresses your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panapintodevelopment.com. Panapinto Properties, building Jersey City for everyone.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design studio and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Hello, welcome to Hudson Health. My name is Dr. Etan Spira. I'm Chief Medical Officer of Jersey City Medical Center, a facility of RWJ Barnabas Health. Today, I am excited to welcome Dr.Etan Spira. He is Program Director of our brand new Gastroenterology Fellowship at Jersey City Medical Center, an Assistant Professor at Rutgers, and also an exceptional gastroenterologist. Really excited to welcome Dr. Spira and talk to him, especially as this is Colorectal Cancer Awareness Month. Welcome.
Thank
welcome,
you.
and congratulations on 1 year of the fellowship.
Thank you. Thank you for that.
Tell me more about that. That was a big endeavor.
That was a big endeavor to get it started. It took, a couple of years to get all the, paperwork involved and all the applications involved ready for the fellowship. But it's something we're really excited to have. It is my privilege to be training the next generation of gastroenterologists at Jersey City, and that improves the access and healthcare for all the residents of Jersey City also.
Right. I always think it makes us a little bit more special. It actually elevates our medicine to have all those learners in our facility and providing care.
Yeah.
So talking about colorectal cancer, something that we don't talk about enough. So we used to think it was a disease of older people. Now, what are you seeing in your practice around the community with the age at which people are being diagnosed? And what's your best advice for younger people?
Yeah, so age is definitely one of the major risk factors for developing colorectal cancer. Classically and historically, we put that age at about 50. So, if you haven't seen the news in a while, you would think I need to start getting screened at age 50. But we've noticed that the incidence of people getting colon cancer at younger ages has been increasing. So whereas we've been through our advanced screening methods, we've been able to reduce that incidence in older people, that incidence is increasing in younger people. So we've changed that recommendation to age 45. So it's important to start getting screened earlier than before.
So personal story, my husband's father died of this disease around 60. Is there an age that people should start getting screened earlier if they have a family member who died of colon cancer?
Definitely. So for most people, that age is 45. But if you have genetic risk factors or many family members or a couple first-degree family members that have died from colon cancer, you want to get started getting screened at age 40 or 10 years earlier than the age of their diagnosis.
So for family members who've been diagnosed with colon cancer 10 years younger than their first diagnosis.
Yeah, so if they got diagnosed at age 50 or younger than age 50, you want to start getting screened before age 40.
And they got diagnosed at 45, you want to get screened at 35.
Exactly.
I think that's very important, and many people out there need to talk more about this, especially in communities where everybody sort of knows somebody who's had colon cancer, and to raise the awareness.
Exactly. And if you have any questions, you should either talk to your primary doctor or talk to your gastroenterologist, who'll be able to give you more specific, personalized recommendations on when you should start getting screened.
Absolutely. So one of the things that, we've talked about all through this month and we continue to propagate is people should get colonoscopies. But you've always told me the best test is the test you do.
Yes.
So for those holdouts that have not and will not get their colonoscopies, what do you advise? Because we do want everybody to get screened.
So the gold standard is still colonoscopy. But again, if you have any reservations about that you still, after talking to your doctor, you're not able to get past, there are other ways to get screened. And so the primary ones are stool-based tests. So we have a couple of stool-based tests that you can do. Some are called fecal immunotesting, or FITs. Those are stool-based tests that you can do at your home. Those have to be done every year. We also have other stool DNA-based tests, and that has to be done every 2 to 3 years. And that one, again, you can do at home and mail into the company, and they'll let you know what the results are.
Got it.
And then there are, coming in the future, which is not really ready yet for general use. Eventually there will be a blood test, which will be sort of looking for DNA changes in the blood instead of the stool, which could be used. But again, those are not quite ready yet.
Absolutely. Really excited. And when those become ready in prime time, we'll have you back on the show to talk about it. So let's talk a little bit more about, sort of colonoscopy as the gold standard, and we can definitely continue because this is a longer conversation. What advances have you seen, both as an assistant professor training the next generation and over your career in the actual procedure itself?
Yeah, so one of the reasons why we consider it the gold standard is the only test that can actually visualize the lining of the colon. And so we've made a lot of advancements in our ability to see polyps or early cancers when we do the procedure. So we have high definition colonoscopy scopes, which basically are, HD or 4K vision. So let us basically pick out very, very small polyps or very subtle polyps more easily that we can then take out. We also are using AI like every other field. So AI, algorithms can, while you're doing the procedure in real time, can alert us to changes in the lining of the surface of the colon that we can sort of see our polyps and take them out. So all these things make it easier to detect polyps earlier and take them out.
That's a fascinating thought. Hold that. We'll be right back.
No one plans on heart disease, but everyone should have a plan for it. We help patients of all lifestyles and medical histories plan for healthy hearts. We offer convenient screenings without judgment, hundreds of preventive programs, and women's heart specialists. And we're the largest cardiac surgery program in New Jersey. Make plans for a healthy heart with RWJ Barnabas Health. Let's be healthy together.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or quick ride through the Holland Tunnel. nursery and private elementary schools all on site, 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants. All major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Welcome back to Hudson Health. I'm Dr. Etan Spira. I am Chief Medical Officer, Jersey City Medical Center, a facility of RWJ Barnabas Health. Today, I'm very pleased to welcome Dr. Etan Spira, an extraordinary gastroenterologist, assistant professor and program director of the all-new gastroenterology fellowship at Jersey City Medical Center. Welcome back.
Thank you.
Welcome back. It was very exciting to talk about the new fellowship and all the advances in GI. So when we went on break, everybody wants to hear about AI, right? Artificial intelligence is everywhere. You know, it's helping us organize our emails and ChatGPT. But to hear about it in this, you know, I really think medicine is that perfect frontier of artificial intelligence. Right. And I actually remember the very first time we spoke, we said that artificial intelligence was going to become very important in colonoscopy. So just tell us more. I'm so fascinated to hear about this.
So I think last time we were here it was in its infancy, but now it's really something we use in our everyday practice. We have it at Jersey City Medical Center. On every colonoscopy we're doing, we're having AI assistants making sure that in addition to our own eyes, we're not missing anything that could potentially lead to cancer in the future. So while we're doing the procedure, it will pick out, you know, any small little thing that it sees, and then we can then go back and confirm whether we think it is something that needs to be dealt with at the time of the procedure.
It's interesting. I do want to walk people through because not only are you looking with your own eyes, there's artificial intelligence, but we have at the backdrop, I don't think people know this, an excellent team of another group of doctors, pathologists that do look at the samples, right?
Yeah. So during the procedure itself, we can only sort of, make a very good guess of whether we think it's a serious polyp or not. But after anything we take out, we send to the pathologist who then look at and look for, tell us exactly what it is. And then we go back and give that information to the patient.
Yeah, thank God for pathologists. Yeah. So now, we talked a little bit in the intro about just general health and wellness, right? Because the gut is a very sophisticated organ, and that would be a topic of a whole show. But in terms of colorectal cancer, what can people at home do to ensure just good gut health?
Right. So I know we've talked about this a lot. The main thing they can do, especially for colon cancer, is make sure they get screened. Yep. But in terms of preventing colon cancer, just eating a generally healthy diet, we know probably helps reduce the incidence of cancer. So in this case, it's a diet high in fiber, low in red and processed meats, and then also, not too much alcohol consumption and avoiding smoking. And those are some of the major things that we know that can increase the incidence. The important thing to know is that even if you do all those things, you're still at risk for colon cancer, and that doesn't mean you don't have to get screened.
Of course.
Yeah.
And especially if you have a family history, you may need to, as you mentioned, be screened even earlier than most people. And, we always, especially in Hudson County, New Jersey City, talk about populations that may be underserved and just, maybe watching the show and thinking, that's a great idea, but I don't have time to do this. I'm busy. And, I haven't seen a doctor in years. Right. I haven't seen my PCP in 10 years. What do you say to them today about getting colon cancer screening?
So colon cancer screening, especially colonoscopy, is the only screening test that can both detect and remove early cancer at the time we do the test. It's a very preventable cancer. It's a cancer that if we catch early, we can cure it. That is not true for all cancers, but for colon cancer especially, it is something that if you stick to the screening that your doctor recommends, there is a very, very high chance that you will never have colon cancer.
That's fantastic.
Yeah.
So last word, you know how passionate I am about our learning enterprise. What would you tell people at home? Because, you started a brand new, and I mentioned this at the beginning of the show, gastroenterology fellowship program. It's really world-class program with brilliant learners. What would you tell those doctors and people at home about Jersey City and our ability to take care of really all things colon cancer screening, treatment, especially at this time when we have this whole infrastructure that we did not have 2 years ago?
Yeah. Well, the first thing I would say is it wasn't just me who started the fellowship. We have a whole team of excellent gastroenterologists at Jersey City who helped me start it. And so we have the ability, we have the technology, we have the equipment to really help you with and knowledge to help you with any, colon problem or gut problem that you may have or experience.
Dr.Etan Spira, thank you. It was wonderful having you on the show.
Thank you.
We'll be right back.
Comprehensive healthcare is here, here, and here. RWJ Barnabas Health is healing, enhancing, and investing in Hudson County with its 2 newest locations, Hoboken and Exchange Place. Within walking distance or accessible by mass transit, our locations combine convenience with primary and specialty care, including cardiology, women's health, orthopedics, cancer care, and more. Let's be healthy together.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Panapinto Properties, Jersey City, shaping the workplace with state-of-the-art office spaces and addresses your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panapintodevelopment.com. Panapinto Properties, building Jersey City for everyone.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
No one plans on heart disease, but everyone should have a plan for it. We help patients of all lifestyles and medical histories plan for healthy hearts. We offer convenient screenings without judgment, hundreds of preventive programs, and women's heart specialists. And we're the largest cardiac surgery program in New Jersey. Make plans for a healthy heart with RWJ Barnabas Health. Let's be healthy together.
Welcome back to Hudson Health. I'm Dr. Etan Spira. I'm Chief Medical Officer, Jersey City Medical Center, a facility of RWJ Barnabas Health. I had the pleasure of interviewing brilliant Dr. Etan Spira as he talked about colonoscopy, screening, prevalence of colon cancer among young people. Lots to unpack there. First thing we talked about was just colon cancer rates is rising in younger people, right? Always been a disease of 50 and above, but we're beginning to find people in their 40s. So in response, the screening age has been reduced to 45 or 10 years younger than the time when the close family member was diagnosed. Again, it's 45 years old or 10 years younger than when the first family member was diagnosed with colorectal cancer. This is important because this is the one disease that is easily preventable and treatable by early screening. And we know for sure that in today's world, with everything we have to do, many people neglect to do that. With Dr. Spira, we also talked about the amazing fellowship program that we have here at Jersey City Medical Center. It's very important to us, training the next generation of gastroenterologists. So not only do we have a great team, we have great learners, which amplifies our ability to take care of a large group of people in our community. And then we just talked about being healthy in general. Like many things, gut health is dependent on overall health. So Dr. Spira talked about a healthy diet, which includes diets low in processed and red meat, high in fiber. He also discussed regular exercise. But again, the theme of the day is that even when you do all that and you're extremely healthy with no medical problem, there is a need to have your routine screening colonoscopies. Access has always been something that we tremendously invested in. We want to make sure that everybody in a community feels like they have access to a good doctor and to a good specialist. So we talked about ways of getting into a system and making sure that our patients are able to come and get taken care of. So this was a wonderful section. He's able to translate complicated work and research and talked about advancements in colonoscopy, the most fascinating being the use of artificial intelligence, which last time we spoke was in its infancy, and that is the warp speed that this is growing, that now artificial intelligence is used as a modality along with the gastroenterologists in colonoscopies. So I was extremely thrilled to talk to him. It's very informative. I hope all of you above 45 schedule your screening colonoscopy. Thank you for joining us on another episode of Hudson Health. Be well.